Hello, everyone, and welcome to the VMC Animal Health Education Series. My name is Scott Horsfall, and I'll be your host this evening as we hear from leaders in veterinary medicine as they share expertise in areas ranging from relevant health information for your beloved pets to ways that we're advancing clinical research that will serve dogs, cats, and people for generations to come. During the presentation, you can use the Q&A function in Zoom to ask questions. We ask that you use the Q&A button instead of the raised hand feature as it helps us better track the questions as they come in. We also ask for pre-submitted questions, and we'll do our best to cover the themes that came up most frequently during the final portion of the program. Please note that if your question for tonight's presentation relates to your pet's specific medical care, it is best to call the VMC directly or have your primary care veterinarian contact our team for a consultation so that we can best serve you and your family. Tonight's format will be a little different than in the past. We'll be hearing from our two VMC interim co-directors, Dr. Mike Henson and Dr. Scott Madill, about what our team has been up to this past year across our 4 hospital sites: the Lewis Small Animal Hospital, the Piper Equine Hospital, the Large Animal Hospital, and the West Metro Equine Practice. Dr. Henson and Dr. Madill will also share a look into some of the things we've been planning and share behind the scenes videos highlighting the VMC's mission and action before answering some of your questions. We'll kick off tonight's presentation with Dr. Mike Henson to talk about the Lewis Small Animal Hospital. With that, I'd like to welcome Dr. Henson.
Let me just share my screen here for a second. So welcome, everyone. Thank you for attending this evening. I'm just going to share a few slides about some things that have happened in the last year here at the VMC. And here we go. So we have a big team working together to serve pets in the area and actually from around the nation, really. So our team served over 17,000 pets last year. We have a team of 57 faculty, most of whom are board certified, 35 residents, 11 interns, and over 150 certified veterinary technicians and veterinary technician assistants working with us to care for animals. We treat mostly dogs and cats across 18 different services, most of which are specialty services. And we are the only Minnesota-based institution that trains future veterinarians. We're also the largest institution that trains specialists, both residents and interns. So our main missions are service and teaching and research. So we also advance veterinary care through clinical trials in a variety of areas. Over the last year, we're happy to say that we reopened some services that were closed during the pandemic, like rehabilitation services and our ophthalmology service. We've installed some new equipment. Some examples: there's our new 3 Tesla MRI, providing very detailed images to inform care for, like, brain images, for instance. We also have a new instrument for arthroscopy. Both of those two are examples where they help with both service for patients, but also clinical trial research. And on the teaching side, just as an example, we purchased what's called a quick lung, which is a teaching instrument for mechanical ventilation for our emergency and critical care team. Over the last year, we also launched puppy classes again to bring new skills to owners and also to expand our behavior education for our veterinary students. We graduated, in addition to a little over 100 veterinary students, also 11 residents and 8 interns. We have had to navigate continued staffing shortages and a very high demand. So that's been a continued challenge this past year. But we've been able to continue our clinical trials for a variety of different areas: pain management, cancer care, dermatology, just to name a few. Many of our faculty also received awards in the past year. And again, in the service, research, and teaching realm, just an example of each, there's many others. So Dr. Stouthammer was inducted into the U of M Academy of Excellence in Clinical Practice, so advancing veterinary medicine. Dr. Jody Lulich, also advancing vet med, but also human medicine, was elected as the president-elect of the ROC Society. That's research on calculus kinetics, good acronym, but studying urinary stones. And he's the first veterinarian ever to hold that position. And another example, Dr. Julie Churchill was chosen as the outstanding faculty member by the MVMA, so awards for teaching as well. So looking forward, we're excited to say that we're going to install a new state-of-the-art linear accelerator, which can deliver faster, safer, and more precise and effective treatments for animals with cancer. We'll have a new CT scanner that'll be installed early next year, which will have increased capabilities over the one we have now, such as cardiac gating. That's where the images are timed with the beat of the heart so that we get more precise imaging of the heart, for instance. Another example, we are renovating some spaces. So we're renovating a room for interventional radiology, as well as new space, both clinical and receiving space for our dermatology service, long overdue. And another change where acupuncture will be embedded in other services and offered by more clinicians in the coming year. So we're very grateful to the many donors and clients who have supported us and made these efforts possible to serve animals in our area, and looking forward to this video. So thanks, I'll stop sharing.
We are a hospital that gives comprehensive care to pets in the Minnesota area, and sometimes even from people who travel from all over the world. We do everything from preventative care.
But then we are that tertiary referral center where we have the equipment and the expertise to see the cases that just can't be managed out in standard private practice.
So we do have a lot of expertise, and so this university helps to percolate that kind of talent and support it so that we can help clients and their pets in the future as well as today.
We're probably the most unique in that we are training, not only just veterinary students, but we're training the next generation of specialists.
Our faculty make it a very relaxed and open environment, which I think makes an incredibly collaborative environment. If it's an extremely difficult problem or a rare disease or things like that, we actually get together in huddles and discuss the case. And it really helps improve patient care. And so even though the clients don't see that, it's happening behind the scenes. And even yesterday on this case, I had anesthesia, surgery, medicine, and critical care all in one room, giving all their opinions on this case, which was really valuable. And you don't always get that where you have multiple doctors and technicians and students on one case and talking about it in depth. So we really cultivate a team at all levels that help care for patients.
So our mission has 3 parts. We provide excellent evidence-based care. We train the next generation of veterinarians and veterinary specialists. And we do clinical research to help pets in the future and even help mankind in the future.
So the Clinical Investigation Center is a really crucial infrastructure, and it's also the only one located on the Twin Cities campus that supports veterinary clinical trials.
I am Celia Backman, and this is Fergus Backman. He's 8 years old. When he was acting real lethargic one day, the blood test came back and he had a pretty aggressive form of cancer. 3-month survival rate if you do nothing. He was lucky enough to be accepted into a clinical trial. That was 3 years ago. So we feel very lucky.
Our goal is to really inform the owners about all the options that are available for their pet, but we usually incorporate clinical trials as an option if it's appropriate for the pet. There is no promise that the outcome will be better, but sometimes it is, and when it is, that's what matters for that particular pet and for that particular family.
I don't think you can get a higher level of care than we had here. Again, I recommend this place all the time.
We're constantly challenging how we deliver care and challenging our ways of thinking and whether it's a medication we prescribe or a new device that we're using for a treatment, pushing for our own growth, the growth of others, and then certainly ensuring that those patients are receiving the optimal care.
But really what keeps me in the profession is the collaborative nature of my job, I can work with students, interns, residents, and other faculty members. I can affect people's lives and help them with their pets and help relieve suffering. And those aspects really keep me here and keep me engaged in veterinary medicine.
Thank you, Dr. Henson, for sharing all those exciting updates. It's fun to see so many areas of the small animal hospital highlighted in the video. Let's now turn to Dr. Madill, who will provide an update on the work benefiting horses and other large animals happening across the Piper Equine Hospital, Large Animal Hospital, and our West Metro Equine Practice. Welcome, Dr. Madill, and thank you for joining us tonight.
Thank you, Scott, for the kind introduction. Good evening, everyone. Thank you for being here. For those of you who aren't familiar with the Large Animal Hospital or weren't perhaps in a similar kind of meeting a couple of years ago, I'm just going to share an outline of what we do in large animals here at the university. And so I'm going to share my screen. So we have three basic units here at the university. We're going to talk about the Leatherdale Equine Center, which is in this picture. But we also have our old Large Animal Hospital and the West Metro Equine Practice, which is located out on the west side of town. For those of you who used to come here with horses 20 years ago, you would be familiar with the old Large Animal Hospital and trying to negotiate a way to park between the buildings and down the slope. We still use the Large Animal Hospital, and basically what we see there are most things that are not horses, but we also see some equine cases down there still. So we see an increasing number of, it says here, potbelly pigs. I will say that some of our potbelly pigs aren't really potbelly pigs. Some of the pet pigs people bring us weigh about 500 to 700 pounds. They're kind of like commercial pigs that have been adopted. But we see goats, llamas and alpacas, yes, although most of those, I will confess, we do sneak up to the equine center. We have a little place up there. We tend to keep most of those. We do still see cattle, especially calves, with the way commercial cattle are going, especially in the dairy industry. We see fewer and fewer cattle as hospital patients, and most of our training for the veterinary students in cattle medicine is done at satellite locations. We have set up a big dairy education center, and maybe we'll talk more about that later, and various specialty rotations as well. Other things we'll see are some zoo animals. We have a contract in one of our departments to provide veterinary services to the Little Como Zoo, which is located pretty close to campus here. And so just last week, I had to help massage a tamarind, I didn't massage the tamarind, but massage a tamarind through the system to get some diagnostic imaging for an injury it had had. So we do that sort of thing too. I will confess we used the small animal hospital to provide that imaging expertise for a tamarind, which is a very small monkey. On the equine side, the things we'll do in the large animal hospital are we try and bring our contagious diseases. So we have our isolation unit down at the large animal hospital, things like salmonella, strangles, that sort of stuff that we don't want to expose the rest of the horse population to. We have big padded neurologic stall down there so we can manage down horses. And some of the diagnostic imaging modalities like bone scan are still located down in that old hospital area. So we'll use that area for some equine stuff, but most of our in-house hospital cases, the ones that are sent into the hospital, we now do up at the Equine Center, up at the Piper Equine Hospital, in the Leatherdale Equine Center. And we get horses from around the state, all over the country, and sometimes coming down from Canada to make use of those services. And we have largely specialty services, but also provide some comprehensive care services, sort of the cradle to old age type services that you might think of. But we tend obviously not to do a whole lot of the vaccination and deworming up there that you would get from your regular vet. And then out on the west side of town, our equine ambulatory practice is there. So students get to see, with enough personnel to be able to spend the time to train them, what it's like if you're a vet out in ambulatory practice. So they provide all the sort of comprehensive care you would expect from regular horse vet, from early foal checks, through vaccinations and dewormings to lameness exams, endoscopies, x-rays if needed. All of that sort of thing happens out at West Metro. And they have a very busy dental practice, and one of their veterinarians actually has a dental specialty in horses, which is really handy. We make use of that in the hospital in here as well. We see a bunch of different kinds of animals. Obviously, our caseload is really biased towards horses, and this is just individual animals, so it's not visits. I think West Metro had about 3,500 patient visits. Obviously, some of those horses repeats last year. I don't remember what the in-house one was, but we see all sorts of things. Some of them are an in and out, a day patient. Some of them will stay here for a week, 2 weeks, sometimes a month or more, depending on what's wrong and how long it takes them to get back on track. So in the clinic here at the hospital, we do tend to focus somewhat on specialized care, and we have board certified specialists as the senior clinicians here that are overseeing the cases and working on them. So there's two in the picture there, Dr. Ernst and Dr. Trumbull, two of our surgeons working on a lameness case. But we have internal medicine specialists and surgery specialists. They lap over into lameness and sports medicine, and we do reproduction as well. And then we also have Sarah, who comes in for specialist dentistry, but also, most of our medicine faculty and residents will also do your regular kind of dental work. And then if something needs to be extracted or there needs to be oral surgery happen, then the surgeons get into that. We're really lucky in that we have shared with the small animal hospital a specialist anesthesia service. So, horses that get knocked out here or anything else that needs to get knocked out gets the specialized care under anesthesia it needs. And anesthetizing horses is riskier than anesthetizing other species. They tend to have a slightly higher fatality rate under anesthesia, complication rate. And obviously when a horse wakes up from anesthesia, the first thing it wants to do is jump to its feet. And so it's really careful recovery process. Some of you may have seen the articles recently in the TV clips on the giraffe at Como Zoo that was anesthetized using anesthesia from here and surgeons from here, and also specialists in zoo medicine from the Minnesota Zoo down at Apple Valley. So real collaborative type effort. We use Dr. Stouthammer as well from the small animal hospital. He'll come up and ultrasound consult on cardiac cases with us. A lot of our internal medicine people have received advanced cardiac training, but Dr. Stouthammer will come up and consult, confirm, provide certification sort of things. And then the dermatology group also here from the hospital, another one we use quite frequently. We do use some other specialties as well from the small animal hospital. Neurology, most of our neurology cases our internal medicine service handles, but if there's something really strange or we need a specialized piece of equipment to measure neuromuscular electrical potentials, we'll call down and get Dr. McVeigh, one of the neurologists, to come up and help us out with that. So, infectious disease is another thing we've got with that isolation unit. We are obviously involved in training your next veterinarian in the number of students that we graduate every year as new vets, but we are also, like the small animal hospital, involved in training the next generation of specialists. So we currently have 5 residents here training they have 3 in large animal medicine and 2 in large animal surgery. And then we have 2 interns this year, 1 in sports medicine surgery, which is Haley. If you're a client of West Metro Practice, you will recognize Haley, who was the intern out there last year. And then our new intern out at West Metro is Katie Watts, who just graduated from our program back in May. So she's new. And I'm sure Mike would echo this, and I must confess, I had to do something else while Mike was talking a little bit, but we couldn't do anything we do, despite all our specialists and all our residents and interns, without the support staff we have, the CVTs, the veterinary technicians, certified veterinary technicians, registered vet techs, our vet tech assistants, and our support staff, be it our barn crew, our office staff. If you've ever been up here, Connie down the bottom left here, you'll be well familiar with. She knows all the clients and is able to get you in. So we're extremely grateful for them. And like most other vet practices, we hang on to them tooth and nail, and we're always looking for good people in those roles, because they really make our 365 days of a year, 24 hours of a day service function. We couldn't do it without them. A couple of things we have really focused on in-house up at the Piper Hospital is our advanced imaging capabilities. So we have a fairly heavy sports medicine lameness caseload, and to really get the diagnostics right on that, you need excellent imaging capabilities. So couple of things we've had over the last few years put in under, I need to say this very gratefully, with the support of clients. So donations, we've put these in. So we've got a standing CT unit for horses and a standing MRI unit, both of which are great because they provide really nice imaging. And they also mean you can do it without having to anesthetize the horse. And if you have a basically healthy horse that just has a sore leg, you want to avoid putting it under anesthesia if you possibly can, given some of the risks involved. So those are two really valuable modalities, and the cases we put through those are building over time. There's just some data from the last financial year on how many cases went through those units. The other thing we tend to focus on is intensive care cases like Mike mentioned, for the small animal hospital that are pretty hard to manage in the field. So they take a lot of time, constant attention, 24 hours a day. So things like colics, bad pneumonias, neurologic cases where the horse may be very ataxic or is actually down and needs to be slung to support its weight. And then obviously foals that get sick. So we have a neonatal unit that's only been open up in the Equine Centre for a couple of years now, again, funded by a donor. So that was wonderful. And then our isolation unit, which allows us to separate those infectious cases from the rest of our hospital. So those are the sorts of things that, while we'll see anything, those are the things we really have put a lot of energy into getting good at. Out at West Metro, and if you've been out that way, it's located out at Long Lake. They have all of the equipment you would expect to see in a top-notch ambulatory practice. So the digital radiology, advanced dental equipment, and I mentioned before that Dr. Weifel has a specialty in dentistry and is well known for it. And we get her in here to the hospital sometimes for some of the dental cases to help us out. So there's communication goes both ways between the groups in that. But all of the sports medicine gear you would want. They have a team of 3 senior clinicians out there. The one pictured in the photo here is Dr. Bergen, who is also the practice manager out there, runs the practice. We have Dr. Kuhl and Dr. Weifel as well, both experienced horse practitioners. And that gives us the ability to not only have the treatment for the horses, but also spend the time to train the students out there. And we've only had an intern out there for about I think this is our 4th year with an intern. And that's been a great addition to the program, and the interns get a really valuable experience out of it. We also have a vet tech out there, Lorianne, sorry, I'll get the name right in a minute, is currently our vet tech out there, and then they're supported by office staff as well. And they have a practice radius at the moment of about 35 miles. So they do a fair bit of driving to get to their appointments. But again, I think I said they saw about 3,500 individual animals visits last year. So I think that's to the end of my thing, and I will stop my sharing and hand it back over to Scott. Welcome to the Piper Equine Hospital, located in the Leatherdale Equine Centre here on the St. Paul campus of the university. I'm Scott Madill. Currently I'm Medical Director here for the Piper Equine Hospital and also our other large animal programs. Down at the Large Animal Hospital, and out at the West Metro Equine Practice, our ambulatory clinic on the west side of town. Overall, our programs serve horses, obviously here at the Equine Centre, but also cattle, small ruminants, pet pigs, and a large number of zoo animals as well. Any time in that animal's life, be it difficulty being born, through a neonatal disease that requires intensive care, through its young development stages, up to in the horse world where it's a performance animal, or for another type of animal, maybe in its production phase of life, we have the facility and the expertise to deal with any problem they may present with. One of the great advantages we have here at the university is these great dedicated spaces specific to clinical work, the dedicated advanced equipment, the specialists with the know-how to use it, and also the breadth of specialties so we can seek consultation across different areas. Getting the best diagnosis and thus the best treatment for your case, your client, your patient demands having the best imaging capabilities. And the best imaging capabilities are CT and MRI, and we have them right here. And not only do we have them, but we have them standing modalities, so the horse doesn't need anesthesia. Much safer, less risk to the animal, and a great diagnosis. We've also got dedicated areas for intensive care on foals and colic cases, and we also conduct research. And the great thing about conducting research is not only do you get to conduct the research and find the answers, but you get to apply that then directly to the clinical cases that you're dealing with. As part of our program, one of our residents, Dr. Alison Booth, is involved in a pain management research project.
The research program here has also allowed us to investigate surgical procedures and bettering them for horses, not only in the pain management aspect, but also putting horses under general anesthesia and improving our surgical technique by altering procedures so that the procedures don't take as long, and we can in turn help not only just help the horse, but have them be under general anesthesia for a less amount of time, which overall improves their quality of time in the hospital and their prognosis.
Another one of our missions here is advanced training of future specialists, our internship programs and residency programs. Our current chief resident, Dr. Caitlin Melnicki, is in the large animal medicine program.
You know, having the experience that I've had here at the University of Minnesota with the specialists here, they have inspired me to want to teach future generations of veterinary students, interns, residents, and with them, I feel vastly equipped to do so. I may not know exactly what my future will look like, but I know that whatever I choose to do, I will do so successfully, and I truly believe that, and that it's been the result of my experience here.
Our facility, our people, and our mission is dedicated to providing the best possible treatment for these animals. And none of that would be possible without the generous support from our donors and clients. Not only does it support what we can do, but it also supports our other mission of training the next generation of large animal veterinarians, be they going into equine, food animal, or mixed animal practice. On behalf of all of our team, from the West Metro Equine Clinic, the Large Animal Hospital, and here at the Leatherdale Equine Centre, I'd like to thank you for listening, and Sierra and I would like to wish you a good evening.
All right, thank you so much, Dr. Henson and Dr. Madill, for sharing some behind-the-scenes insights on the VMC. I'd like to now move us into the Q&A portion of the program and answer some of our participants' questions. I will have sent out a reminder that if you do have a question for either Dr. Henson or Dr. Madill about the VMC, if you would like to chat that to us, you can use the Q&A function in Zoom. It's at the bottom of your screen. Just chat it to us and we'll do our best to answer it during this last portion of the program. So if Dr. Henson and Dr. Madill are ready for the question, I think the first couple might be general, so I'll let either one of you take them. The first one is, first question is, why is there suddenly a shortage of vets? Is the university feeling a vet shortage, or is it mostly in private practices? There's a follow-up to that too that asks about how small farms get the veterinary resources they need as well.
How about if I take the first part, Scott? So So regarding shortages, it's really at all levels. So our biggest shortage is really in veterinary technicians, who are called veterinary nurses in some other states. And so that's the greatest need. But there are shortages of veterinarians, veterinary specialists, both in private practice, general practice and specialty practice, as well as here in academia as well. So there's shortages at all levels, unfortunately. The question regarding why there's a shortage, so there's multiple factors there. So some of it is related to the pandemic, but it preceded that as well. So regarding veterinary technicians, several years ago, we had closure of several of the training programs here in this state, which of course reduced the number of technicians that were graduated. But that's not just, this is not just a Minnesota thing. There's a shortage of veterinary technicians across the United States. And there's also a pretty high turnover rate amongst veterinary technicians, as high as I think about 25%. So remarkably high turnover rate. And there's a number of reasons for that. Salaries is one of them. There's an opportunity for them, to use their expertise, like for instance in the human field, and earn a higher wage. Most people that are in the veterinary field are in it for the love. We like animals, and so they're not in it for the money, so to speak. But ultimately, there's student debt and other opportunities, and the veterinary field can be a hard job, and so there's a turnover problem with that, and we're doing what we can to try and retain all of our technicians here. As Scott said, we're so grateful for the work that they provide and the help they provide in teaching our students and caring for animals. We really can't say enough good things about our certified veterinary technicians and the technician assistants. So we're doing what we can to increase salaries and do other things for retention. So there's a technician shortage, which without enough technicians, then even if you have enough doctors, you can't see as many patients. But we've also been losing veterinarians as well with COVID. There's an increase in number of vets, and certainly people staying at home more, and so they see their old pets having problems and wanting more services. So there's an increase in demand for services at the same time that people were taking early retirement and are leaving the field, both veterinarians and veterinary technicians. And so there's fewer of us left to do the work, which means there's more work per person to do, which leads to some burnout issues, and honestly compounding that is of course, I'm one of them, a pet owner. If my animals are unwell, you're worried about them. And if you can't get the services that you want when you want them, some people, get angry about that, and they might not treat the veterinary technicians quite as nicely as they used to. And so that leads to burnout and turnover as well. So, and then you've got, once you hire new people, you have more training. So basically the whole veterinary system is less efficient than it was 5 years ago, because there's fewer people and more and new people in training. And so that slows down the whole process. It's almost self-perpetuating to some degree. And so we're doing, what we're doing is to try and take care of our team, do the best we can for who's here to invest in their training and keep them on a growth pattern for their own development and keep them happy. So I think that, the large animal question, Scott.
I'll say what he said is kind of the answer. I'd say, I guess I'll talk a little bit from the large animal side too. There was a fairly damning study done not that many years ago now on equine, which is what I'm most familiar with. And at the time, I think they said 1.3% or something of veterinary graduates went into the equine field directly into a full-time job that was not an internship, and another 4.5% went and did internships in equine. But the damning part of it was that within 5 years, 50% of those people have quit equine practice. And that's a huge problem, and the American Association of Equine Practitioners is trying to figure out what to do, because they're concerned about the future of equine medicine as we are, and all sorts of veterinary medicine, making sure we have enough people in there. Part of the issues, and there was also a study done from Iowa to look at, rural veterinary medicine down there, and part of it is there's a perception that salaries are lower out in rural areas, which isn't always true, but that is the perception, and so new veterinarians graduating with a large debt load don't look at that favorably. Obviously, they need to pay off their loans and try and get on with their life, buy a house, start a family, that sort of thing. But another thing is the on-call. So if you work in a practice in a city, most times, once 5 o'clock has come and you're not seeing patients anymore, if the phone rings after hours, it goes to a dedicated emergency clinic or the emergency clinic here at the university. And you're not called out of bed in the middle of the night to do that. So if you're in a rural area or an equine practice, you are the one, called out of bed. And so, people are looking at how do we do that? Can we sort of group together and provide these emergency services after hours between practices and share it? And that's great, except it becomes a problem with the distance. I think I said that West Metro has a radius of 35 miles. So if they're covering 2 other practices that each have a radius of 35 miles, if you do the silly math, then potentially they could be going, 100 and something miles to see an after hours call. So that becomes a bit of an issue for the control. So yeah, it's a huge area from that part. The USDA does have the federal government has a loan repayment program. And you can actually get on the website and you can see in your area. So I think it's, they will pay, like $20,000 a year or something off loans for qualifying veterinarians who work in an underserved area, I think, if the loans qualify. And you can get on the USDA website. You can actually see in your area, is there one of those positions open, and has it been taken up? You can see what stage it's at. So that's another thing. From the specialty standpoint, we are competing directly with private specialty practices for the same individual. In some instances, some of the specialists don't want to teach, but some of them are perfectly willing to teach. But some of those private practices offer a 4-day work week and a very high salary that sometimes we have a hard time competing with, given all the other missions we have. So there's multiple factors involved.
I guess I'd just add to that is the fact that the shortage of veterinarians is obviously a big concern for pet owners needing to get care. That's stating the obvious, but it's also a huge concern for the veterinary professionals that are still in the field. So we've really been dealing a lot with moral distress in the field, and particularly since it was before, but the pandemic has made it worse. And knowing that there's patients that need to be treated that you can't care for within the hours of the day takes a big toll on the team. And some people can't, they leave the field. So it's a big problem. So we're looking at ways to care for our team, and there's veterinary schools are looking at increasing their class sizes and to train more veterinarians, new veterinary technician schools. So a variety of things we're doing to try and address the issue.
Yeah.
Thank you.
The University of Minnesota. Oh, sorry, Scott. The University of Minnesota has just gone into an agreement, a 2+2 agreement with South Dakota State University, where there are 20 students per class over in South Dakota State. It's just started. It's in its 2nd year, and they train in the basic sciences for vet medicine over in South Dakota State. And then for their 3rd and 4th year, they'll be coming here to do the more clinical courses, and then their clinical year will be done here. And those students are focused on rural practice. So that is one thing that is being tried, and there's a number of those things happening around the country.
Thank you. It's actually a really good segue into a question that just came through in the Q&A. And that is, what steps are we taking at the Veterinary Medical Center to address mental health needs of our staff?
Great. So good segue, guys, because I was alluding to the moral distress that is affecting our team. So recognizing that as an issue, recognizing you may be aware of the Not One More Vet website and coalition of people who are trying to directly address the fact that suicide in the veterinary field is significantly higher than other professions, almost 3%. And so obviously that's at that end of the spectrum. So there's mental health concerns, before we get to that degree. And so recognizing that concern both amongst our team members and our students, we've invested significantly in our programming and our staff on that front. So we have went from a part-time to a full-time social worker in the Veterinary Medical Center who's there to help families with dealing with difficult issues regarding their animals, but also to help everybody who's in the VMC, basically the students, the faculty, the house officer, the interns and residents that are in the VMC. So we have our veterinary social worker, we have a dedicated counselor for our veterinary students, and we hired a director of programming for well-being and student success, I think is the title, and so she is involved with trying to not just take care of those who are in need at this point, but to help people to get the skills to be able to manage the stressors of a challenging profession. So working on the prevention side of things, the well-being part, and so we went from a time person to 3 full-time individuals involved in caring for our team members and our students. You're muted.
I was talking and I was muted. That's a problem these days we have in lectures too. I would say that was a very directed effort because we very much, I think, followed the recommendations from the American Association of Vet Medical Colleges when we were looking at what kind of programs to put in place at the collegiate level. We went to them and said, what are best practices? And they have PhD social workers on staff there and are looking at what are best practices, and the structure we put in place here at the university very much mirrors that best practices that they have recommended.
Thank you. As we're kind of talking about or thinking about preparing future veterinarians, what can middle school and high school students do to best prepare themselves if they're interested in attending school to become a veterinarian?
I feel like a failure here because neither of my kids became veterinarians.
Mine didn't either.
So obviously, one thing they need to do would be to get in and shadow a veterinarian. I mean, it may start as a job, as a kennel attendant at the vet clinic, and then gradually work their way up as a vet tech assistant, working in the practice, doing the reception desk work. So they really understand what veterinary practice is. That's one thing the admissions committee certainly looks at. And I think for longevity of career, it is good to know exactly what you're getting into before you get into it. And then the other thing my wife would say, who's also a veterinarian, is customer service jobs. Because even though, when you're young, you say, I want to be a veterinarian, I want to work with animals, all those animals come attached to people. And it is really, the animal can't tell you what they want. You can listen to their body language and palpate and see where it hurts and do things like that. But you have to be able to talk to the person, and customer service jobs are really valuable in that. So waitressing, being the greeter at anything like that, when you're doing customer service is a great job to get.
I'll just add to that, they need to develop good study skills and practice, because it is still a competitive field to get into the veterinary field. And so that practical experience is important, as well as studying hard.
Thank you. The next question I have is, what can be done about the rising cost of veterinary care? A number of longtime pet owners have decided they can't afford to care for pets, or they're potentially not even taking their pets to get vet care anymore.
I'll start with the small animal side, if you don't mind. So You know, the old adage, an ounce of prevention is worth a pound of cure. And so very good preventative care for your friends, and particularly early detection of health problems will ultimately result in lower costs. As things progress, as they get more advanced, the prognosis is worse, the outcome is worse, and the overall costs tend to be higher. And so some things that you can do. So prevention is an important part of it, and people don't like this particular answer, but it's kind of the same stuff as for us, right? So good nutrition and exercise, a lot of exercise for animals and dogs in particular, an hour a day would be ideal, and maintaining a healthy body condition. There's a good study, a long-term study of dogs that showed that just maintaining a healthy body condition delayed the onset of chronic disease by 2 years and improved longevity as well. Is something as simple as just maintaining fitness had take a dog's lifespan of 12 years, adding 2 years onto that is a big percentage of lifespan just by maintaining them healthy, lean, and fit. And so going to your veterinarian and identifying things early, proper dental care, all those things can hopefully ultimately prevent some of those more significant costs later on. But the other answer to rising cost of healthcare is really, the trend will be towards pet insurance for those families where that works, or for those that it doesn't, starting a pet, savings account or something like that, so that you're ready for something catastrophic when that occurs. If you look at the data, only about 3% of people have pet insurance in the United States as of a couple of years ago. That was the data. Whereas 25% or so of people in Europe have pet insurance, and so it is a not common here. And the cost of care is definitely going up. If you look at healthcare, the cost for medications and medical equipment and so on, for a decade, the cost, the increase of costs of those things has far exceeded inflation year on year, and of course everything's more costly now with inflation. Everything's gone up quite a bit. So cost of labor is higher, the cost of equipment and supplies and medication. So you're absolutely right. The cost of care is going up, and so some of the things we can do about it is to plan ahead and try and prevent where possible. That's the high level answer. Scott, do you have anything to add?
I think that's very true. Obviously, in the food animal side, a lot of the food animal stuff has gone to the point where if it's a commercial animal, they basically don't do veterinary care on it beyond the preventive health care. If it is significantly sick, it will be culled. They no longer do much in the way of individual animal treatment on that side. I would say that that's one of the reasons that our bovine caseload has gone down, because even 30 years ago, a lot of cows had names. They might have had a number, but they also had a name, and people would treat something with a name. But now none of them have names unless they're the world's greatest show cow. And so, that's just the reproduction unit on that end. Horses are more towards the dog side of things. And I think, every time we make an advancement, it's wonderful. The trouble is, rarely are those advancements cheaper than the thing that went before them. So it's like in human medicine, it gets better and better and better, but it also gets more complicated, and the implant is more complicated and higher end to get that done. So yeah, it is a problem. And currently I don't have a dog. We had to put our old dog down about 3 years ago now. But I'm sort of a believer in the veterinarian offering genuine options, right? Mm-hmm. So, and being fine with whichever option you choose, and you should be fine with whichever option you choose. So there's like the platinum level, it's going to cost this much and have this outcome. But under that, there's the gold, the silver, the bronze, and the bronze is a perfectly acceptable option. And you just got to look at it and say, yeah, my animal will probably not get this whiz-bang fancy implant, but my local vet can do this if cost is a significant issue. And Mike mentioned the insurance thing. I blew out my appendix a few years ago, and if we had not had health insurance, I shudder to think what that would have cost us. It probably would have sent us bankrupt, and my wife and I are both professionals in the veterinary field. So the insurance thing is good. A number of our horses do have major medical. The high-end horses do, but people do make hard decisions with horses that don't have that. It's a vexed question.
Indeed. And I think, there's the question of cost and there's, which is very significant when you're making those decisions. There's also the question of value. So, as an educational institution, not for profit, we strive to provide great value for our clients that they get both what they need as well as an education about their problems, and in the process we're meeting our missions of training students and learning more, and part of how we keep our costs down honestly is through partnerships with wonderful people who support our missions, who help, like as Scott pointed out in the video, the standing MRI and CT, our new MRI and our CT scanner as well, the linear accelerator, a variety of things that I highlighted were also supported by people who believed in the mission, and that helps us, of course, to keep our costs down. If we had to pay for those multi-million-dollar pieces of equipment from for instance fees for service, it would be more like human medicine. The cost would be crazy high and even more out of reach for too many families.
Thank you. To keep the conversation going a little bit on lifespan for animals, we had a question that came through that said, I'm curious about your thoughts on lifespan for canines. Do you see evidence of it increasing as opposed to a decade ago? Are there any specific things that can be done to extend or improve later years in dogs?
Well, I did answer the latter part of a little bit, and that's really fitness, maintaining a healthy body condition and exercise fitness. That's the one thing that has made the biggest difference in overall longevity that a family member has direct control over. It's definitely true that dogs are living longer than they used to. The specific question to 10 years ago to now, my opinion is that the answer is yes, that dogs are surviving to later years throughout my 40 years in this business. That certainly seems to be the case. We used to say 10 years of age was about average, 10 to 12 for small breeds, and 8 to 10 for larger breeds. And now we see, plenty of patients that are 15 and 16. And I'm an oncologist, I'm a cancer doctor. My impression is that it's continuing to improve over time. And there are, the fun things are that there are investments. There's the Golden Retriever Lifetime Study, which is a 10+ year project looking at about 3,000 dogs over their entire lifespan to look at some of the genetics. And then there's another project called the Dog Aging Project, which is still enrolling patients. I think if anybody's interested, you can Google it. And they're trying to identify those genetic and environmental factors that are associated with that influence aging. Basically, they're trying to see what affects what they call health spans, how long an animal has of healthy, good quality, functional, having a good time life, like dogs are supposed to. And they're looking at a variety of different factors in a very, very large population of a variety of different kinds of dogs, not just golden retrievers, any breed. And so if you're interested in that, you can Google that.
Yeah, I looked at a video of that dog aging project the other day, and they're still enrolling even if you have a golden retriever or a Labrador or a German Shepherd, but they're really interested in you if you have a large breed dog of a different breed to those. Yeah. They're really looking at some of the genetic influence as well. And it wasn't asked at all, but I would say the same thing is true in horses. We see a lot more 30-plus-year-old horses now than we ever saw before. And I think it's down to nutrition and preventive care. they get to be that age.
Which unfortunately wraps back into the question about the cost of care. We are the product of our own success to some degree, because families are doing such excellent care for their animals compared to what we had, 50 years ago. The dog's lifespan is essentially doubled in from 100 years ago to now, and as a result of them living so much longer, they're now getting some illnesses that tend to be kind of costly and ongoing. So they live long enough to get kidney disease or heart disease or cancer, whereas they used to die of infectious diseases or being hit by a car or other kinds of preventable disorders. And so now, because they're living longer, they live longer. There's a longer lifespan, more costs over the lifespan, of course, because they're thankfully staying longer, but they also have diseases that end up being more expensive. So it's like Scott says, we get better. The new technology is better, but unfortunately, that new technology is sometimes more expensive. So I totally agree with his comment about options. We always try and provide options for care so families can find something that fits well with their family.
Thank you. I think looking at the clock, we got time for probably one more question. And I think it'd be a missed opportunity if we didn't talk about emergency medicine and veterinary care. I think it's forefront of a lot of our clients' mind. So would you mind talking a little bit about how open the Veterinary Medical Center is for emergency and kind of tips for our clients for kind of navigating the scene if they do have an emergency?
So sadly, 2 years ago, if you had asked us if we would ever have to pause admissions on emergency, the answer would be no, we never would do that. But that has been the case since the pandemic. And that is not a university thing. That's all across emergency clinics throughout the entire nation. Emergency clinics are having to pause admissions for a while because they're just too backed up with the number of patients that are there for them to be able to handle, or the capacity of their intensive care unit. In our case, some of the reasons why we have to pause is because our ICU is full and we don't have the capacity and the nursing capacity to be able to take care of additional patients. They're better off going to another institution that has that capacity at the time. So really, our life in the last couple of years, and I would say, for those people who are waiting for specialty services as well going forward, everything we are dealing with now is triage. We look at the cases and trying to determine what's the severity of this one, which one needs to go first in the line. And that's true for emergency and other services. So the emergency service and urgent care is open, but not all the time. There are times that they pause, not for all day, but sometimes for an hour or 5 hours, 8 hours, they have to pause new admissions until we can get caught up, or some patients is healthy enough to move out of intensive care, and we have room for additional ones. And so I have to say that the answers are the same. The veterinary technician shortage is one of the biggest factors that limits our ability. We now have been able to hire enough doctors, emergency doctors. We're now okay there. We were deficient for a while. We're doing better there, but we are still low on veterinary technicians and veterinary technician assistants. So that answers your question.
Dr. Madill, do you have anything to answer or to talk about for large animal at all?
I think we actually paused once in large animal, and it's the first time I can ever remember doing that. And I was reminded the other day that I've been here 27 years. So, but it was one of those cases where it was a capacity deal. I mean, we had been slammed with cases. We had a lot of high intensity cases in, and the people who were looking after those cases were getting really tired. It's like the old line you used to hear about the doctors. You don't want to go in for an emergency at about the 30th hour. That doctor, that intern has been on shift, because you're probably not going to get the most awake doctor who's going to make the best decisions for you. And we just decided that realistically, we can't treat any more patients to the level that we want to treat them and that they deserve to be treated. And realistically, unless this is something that is totally cannot make it to another facility, in which case we will take it, but for the care of that animal, we would send it somewhere else. So yeah, it was just one of those deals. And part of it is the CVT situation where we sometimes don't have enough people on staff, just with the hiring issues, to be able to cover all the things we really want to be able to cover. So yeah, it's a similar thing, but not as intense as what it has been in small animal, because while people have all got the COVID dog or the COVID cat, not too many people went out and bought a COVID horse or a COVID cow.
Excellent. Thank you. Thank you both, Dr. Henson and Dr. Madill, for your time and your expertise. And thank you to our many participants that shared such thoughtful questions in advance and during the presentation. As always, the Veterinary Medical Center is here for you 24/7 to help care for your pet. Please don't hesitate to reach out to us. If you enjoyed learning about our team's work tonight, we encourage you to visit our website or reach out to us directly to learn more about our mission to improve the health and well-being of animals and people. Many thanks to everyone joining us tonight who supports the VMC through philanthropy. Gifts play a critical role in expanding our work, and we thank everyone joining us tonight who supports the work we do. Next month, we are back to our focused health topic presentations with Dr. Jamie Santharaja from our Urgent Care Service, who will present on osteoarthritis medical management, the few meds approach. Thank you again for joining us tonight, and we look forward to seeing you next month. Have a nice evening.
Thank you all.
Thank you.